We had a conversation in the backyard where we were talking about healthcare in general. You were locoming at the time.
Yeah.
That was just when the pandemic started.
Yeah.
And we were talking about how challenging it is to find jobs.
No, it started off because you had a way cooler job than me, and I was jealous. Because you were working at Harvest, the venture studio, doing the startup company, like, consulting building thing, which I thought was pretty neat. And then we were talking about, like, is there anything in healthcare? And then you're like, well, let's come up with something, let's brainstorm something. That's where it really started.
The whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Vollrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward.
Yeah, you're right. And then you were working for TELUS at the time.
Yeah.
Since being responsible for the Alberta telehealth delivery. And then we put our heads together, putting together a spreadsheet.
Oh yeah, we brainstormed some ideas, and then you came back like the next week with the most outrageous looking spreadsheet I'd ever seen. It had like 8 tabs on it and like a whole bunch of math happening. And you change one variable, you're like, look, we'll be billionaires. The graph went up.
I think the main motivation behind it was, realizing that just healthcare is so fragmented. And I mean, you were clearly having an issue finding the right opportunity, while also being involved in the community. And then that you're not the only one. This is like an issue throughout. Experiences for physicians are not necessarily, I guess, what people coming out of school or med school expect. And so finding the right place to work is a real challenge. That's how we got started. Right?
Well, it was the combo of two things. There was like the jobs problem, which I was experiencing, but then while I was working at TELUS, they used Slack. Like that was their business communication tool, and it blew my mind because I'd never seen anything like this in healthcare. Like where there's just like a group community chat forum for all the people that are working on the same thing, and then it was just super helpful. All the doctors would be talking to each other, asking each other questions. How do we set this up? How do we do that? What do we do with this patient? And it was just like, why did we not just have this in general? And so that was where the original idea for building the medical network came out of. We're like, okay, well, we'll start with the jobs thing, and it'll look like LinkedIn. But the goal was to have that connection, the community actually like bringing together the healthcare practitioners.
Yeah, exactly. Building the sort of healthcare connected, and then building tools on top of the network that provide true value. So it's not just a fad in terms of like connecting people to look at cat pictures, but rather like disseminating valuable information to that.
Exactly. Like a pragmatic business tool, not like the Facebook for doctors where you're just like, it's kind of superficial and recreational, but more of like just this thing solves business operations challenges and is useful on the day-to-day.
Yeah. How do you think we're doing so far?
I thought it takes a lot longer to do things than initially you imagine, like just like how long it takes to like build the actual platform, like just coding and creating things, and then there's the actual like testing. Like you remember the early phase of the whole network was just like so buggy because we didn't really test it.
It was crazy. So like I think we had the idea in May 2020, and 2 months later we went live. We actually went live with the first app, so I think we were like super fast and like trying to test it. And like obviously you were having like user interviews, like really making sure that we sort of hitting the nail on the head with that initial delivery of the network, but then also the job function essentially. Initially we focused on just locums, and then we very quickly expanded to other jobs as well. And we realized that after going live, after like 1 month, like my background is mostly in business development, but also some of the biotechnology, and coding was sort of secondary.
Yeah.
And for some reason, the entire database of the app was duplicated onto our users' phones, which is not only insecure, but just not scalable. So we had to rebuild the entire thing and release a new version, I think, like a month after. Yeah, it was fun. It was fun.
So yeah, it took a lot longer to like actually build the stuff, and then it takes a lot longer to get people to use the things. Like we figured, okay, there's a doctor shortage. And we're doing this whole thing, it's free, it doesn't cost anything, like we're giving away water in the desert, well, like people will be flocking to it en masse. But it definitely took a lot longer to like actually get the awareness and the visibility within the medical community. Like it's just like a very closed, locked down, conservative sector. And so that definitely was also quite challenging, didn't expect that up front. And then like anything external, anything you're waiting on for like a third party to do, obviously they've got their own priorities and things going on, whatever other like side project kind of thing coming from another company or another organization like us is like often low priority. So it takes a lot of time to actually like any of these external partnerships or dealings or like sales operations with the clients, like everything just takes a lot longer than I'd initially thought it would.
Especially in healthcare, because you're right, like it's super regulated.
Yeah.
But then on the other hand, like I think there were also a lot of champions early on. Like we talked to the PCNs who started to promote us here in Alberta. The Canadian Medical Association gave us the innovation grant within like a few months of us releasing, which was incredible and actually got us kickstarted.
Yep.
It allowed us to kind of do full-time work and then really pursue Cherry Health to where it is now, which is really incredible.
Well, yeah, you took the plunge, quit your job.
Yeah, that was a big step. Like in the winter of 2021, we went like full-time.
What were you thinking when that happened? Were you like, oh good God?
I was like, let's go. Let's go. Let's build something massive. Let's build something really cool that solves like real problems.
Yeah.
Yeah.
So at the time, what were you working on at was that at Harvest or what was the other one called?
I was involved in like 2 venture studios at the time. One more focused on agriculture and the other one more on fintech.
Yeah.
But my background prior to that was always in healthcare. So I used to work for Bayer Pharmaceuticals, also in the venture investment side. And then prior to that, worked in academia and did my PhD also mostly on focusing on building products for patients and healthcare professionals. And so, like sort of that lack of adoption in healthcare was always very pervasive, and the challenges with that as well. And I think like one of the interesting things that we're also doing with Cherry is, like we're connecting healthcare, but healthcare is, you think of the physician and the healthcare practitioner as sort of the main delivery and provider, which is totally true. But then you have sort of the subset of demographics that help, right? Like you have the MOAs, the assistants that help to run your clinic effectively. You have the nurses and everyone else that essentially help the physicians, and then you have product and therapeutic providers that also play a fundamental part in the delivery of care. And that always struck me as really interesting, is there's no really easy way to connect with physicians effectively. And I think that is in part also one of the allures of Cherry Health, that we're building sort of this digital distribution channel, between healthcare practitioners, but also for industry to access healthcare practitioners in a meaningful way, not just in an exploitatory, appetizing way.
Exactly, that gateway for things to actually get disseminated, because that's the biggest problem right now, right? Like we use Facebook for everything. Jobs, patient care, logistics, like vetting companies and vendors, service providers. And so it's just very helter-skelter, like it's all over the place. You don't really have any like organization or superstructure to it. You don't know where these pockets of doctor groups are unless you stumble across it by accident, or you're like really searching specifically, hoping something exists, or somebody else invites you to it and you're like, oh cool. And so it's, again, very fragmented, just like with many other things in the digital health space.
Yeah, I actually made some notes of that, actually, in terms of like trends within Canadian healthcare. And like I think like one really interesting piece that I thought was, technology adoption within healthcare. Like what do you think, like around, how it's currently going, where it should be going within that? Because there's always, it's a double-edged sword, I feel like.
It's slower than we would like, for sure. You can see right now, like, the entire system is just plagued with slowness and inefficiency. The CMA, the Canadian Medical Association, they've got their big $10 million grant call out for proposals right now for reducing the admin burden. So it's like the number one, I don't know if it's the number one, but it's like the top couple things just like impacting the system right now. There's just not enough tech and adoption and tools to make and speed up, automate the mundane and the redundant and all these things. So everything is still like one-to-one, manually done. It's like you're 100% sure that it's getting done correctly and the human is looking at every single step, but anytime a lab gets ordered, an image gets ordered, I mean, there's like 5 different places that this internet fax gets processed through and categorized and tagged and assigned to people, and all the different, like, everything you do with a patient has to get documented and charted, like, just for your own, like, legal protection, just so there's a good record if somebody else takes over care. So, like, the more charting, the more actual, like, note taking you do, the better. But of course, that takes a lot of time. So that's where these, like, AI ambient scribes look really promising. Like, you just completely focus on patient care. You don't have to, like, write anything. Now there's tools coming out that actually, like, layer on to the EMR to actually do function. So before we would have macros. That was, like, the best thing we'd have if you were using an EMR. You'd type, like
an Excel macro, basically.
Exactly. You'd type, like, / back pain, and then it would, like, pre-pull up, like, some copy-pasted text, and then you'd fill it in. But now they have, like, actual function macros layering onto your EMR, so you would tell it, like, write a prescription for this, and it would, like, pull up the prescription writer and, like, fill in the drug and the dose and the common thing. You still assign it off and okay it, but it saves you a bunch of clicks and typing. And
very interesting.
They're starting to get this extra layer of tech added onto the tech now. And so there's just, like, no shortage of things to speed up and improve. So access to care is one of the biggest problems we have right now, and so making all the healthcare providers more efficient. That's the goal.
Today's episode was sponsored by Fomaderm. Fomaderm is an advanced compounding base for topical drug delivery, proudly developed by researchers right here in Alberta. Unleash the power of topical diclofenac with Fomaderm's nanotechnology to improve skin delivery, ensuring precision and efficiency. The non-greasy, water-based foam formulation is preferred by patients and lets you use significantly lower concentrations of diclofenac to reduce skin irritation and side effects. Elevate your patient care with Fomaderm. Visit www.rstherapeutics.com today to receive some free samples.
Yeah, I couldn't agree with you more. And I think, like, it's really interesting. I spoke to one of the sponsors that we had on a recent Cherry networking event, physician networking event, and I think he was talking about his company that was doing very similar things. So, like, trying to support the MOA with AI. To the point where they could become much more effective and also alleviate a lot of the sort of administrative burdens for the physician. And I think, I don't know who it was, must have been Dr. You must know, the name comes probably back up. She was saying that we've been disappointed so many times with technology. They've overpromised so much and never really delivered in the past sort of decade when sort of tech really took off in health tech. But I think there is sort of a natural suspicion with everything that comes out nowadays. But it feels like with AI and sort of generative AI, there's sort of this shift change in terms of capability.
Partly out of necessity, because you have to. Like, just, like, the system is so strained right now that you have no choice but to, like, optimistically hope that all these things coming out are the secret tool to unlocking that productivity, but also because it's just so much more mainstream now. Like, ChatGPT 3.5 hit the market a couple months ago, and it just blew up everywhere. Like, now AI is a household name. Like, your grandpa knows what AI is and might even have it on his phone. And so it's just, I don't know, there was a lot of that, like, suspicion in medicine just forever anyways. Show me the evidence, what's the data say? When it comes to, like, patient care and treatments, like, okay, what's, like, the actual number needed to treat? How many patients am I going to harm by using this versus how many am I going to help? And that same level of suspicion has, like, transitioned over to the tech and the tools. Everybody's just skeptical of everything. Like, okay, what's the actual downside? What's going on behind the scenes? And so it's just been, like, very, very much more slow and conservative. There's, like, more privacy. There's more security laws and protocols needing to be followed. Anytime you adopt, like here in Alberta, at least legally with the Health Information Act, anytime you adopt a new technology, you are supposed to, like, submit a new privacy impact assessment, which is a whole giant monstrous process of documents and policies, and have that approved on. So anytime you do anything other than, like, update existing software or add a new user to your existing software, you are supposed to jump through all these hoops, which obviously keeps people's data more secure, but it does really kind of pose a barrier to actually improving things, trying new things, right? And then just that barrier to entry. If you want to switch electronic health records. Like, let's say you're like not 100% happy with this one and you want to try out a new one. It's not just like you download a different antivirus program, pay your $20, and then 8 minutes later the whole thing is fully set up and done. It takes months and months and months and thousands of dollars to like migrate your patient data from one system to another. Everything's got to get ported over. Every field, every individual piece of data gets mapped over to the appropriate spot in the new software. You're reconciling manually all the discrepancies in the areas, and obviously you got to like pay the electronic health record vendors to do all this. So it's not like it's easily switchable for some of these things. And the EMR is like the main software tool that physicians have in their clinics. Like that's pretty much like the thing. Like I don't even know what else you have. Like
it's like everything revolves around.
Yeah, that's like your operating system almost for healthcare is your EHR, and so just that huge switching cost really slows down things because all the new innovation and everything is getting layered into those EMRs or like the crosstalk connectivity between EMRs or not. Yeah. And so there's like that big barrier to entry to upgrading your core tech.
Yeah, I think the EMR business is such an interesting area to be in, and like we've had the pleasure of talking to, or you had the pleasure to talk to multiple new EMRs, like companies that starting up in BC and in Alberta, and kind of like trying to solve that incumbent that you were describing, which is like companies that have been around for decades, didn't really have a need to innovate because once you're in a clinic, it is very challenging for the actual physicians and healthcare providers to switch. And the initial setup is expensive, but once you're in the clinic, it's you're probably there for life.
It's sticky.
Yeah, it's a very sticky product. But I think there's some really exciting changes happening, and EMR providers are seeing the benefit of interoperability and trying to move into that space. But it's also very much a shift from the existing business model.
It is. And so hopefully that process just gets more and more smooth. People get more accustomed to upgrading their tech, trying new things. But I mean, like, people are still using the software and the technology until it gets sunset by the manufacturer. There are people out there still just using paper charts. They're like, to hell with it, I'm not going to bother. Like, this is too much.
It's changing all the time. Yeah, it's crazy, actually. Yeah. That's still the case. And I think we did a recent sort of market scan. I think there are over 700 EMRs in Canada.
What?
Yeah. I mean, some of them must be really small in terms of market share or extremely specialized, super proprietary. And then you obviously have some of your larger players, but like there's a lot.
Yeah.
And I think that doesn't stop, right? Like you start with EMRs, you go for administrative solutions as well. Then you go into hospitals and you have like more sophisticated softwares that do very specific things. So I think sort of the burden of having to vet which technology best fits my workflow is only going to become bigger. You almost need like a way to compare and let's easily see what's out there.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today.
It's tough. There should be like a speed dating for EMRs set up. You just like log on and go check them all out all at once.
Something to keep in mind. Something to keep in mind. It's like topic because we talked a lot about AI. I think something interesting. I'd like to go a little bit more into like actual care provision. What about telehealth?
What about it?
I find that like especially in Canada, like provinces take a very different stance on it, and like how they value it in the overall pathway of providing care. Like in Ontario, there have been massive shifts in billing codes, which actually render telehealth being less useful to use, or like from a operating a clinic perspective. And so a lot of physicians revert back to normal care or care within the clinic, where you can see a lot of benefits, but at the same time, from a convenience factor for the patient, telehealth is great. So I know, from a physician perspective, how do you feel telehealth's role should evolve within the delivery of care, and especially continuing care?
I mean, I think telehealth is great. Like, just customer experience is something largely overlooked in healthcare from the get-go. Like, doctors not getting paid by the patient, doctors getting paid by the province. There isn't that direct, like, financial incentive to, like, have a good experience. The patient can go and poop on you and rate my MD, but nobody really cares. Everyone just writes it off as like, it's just whiny patient. So, like, it's just like not something that's been paid a lot of attention to. I mean, like, does a patient need to come into your clinic, book half a day off of work, and sit there to get a refill on their prescription every 3 months or whatever it's been set up to, right? So there's just like a lot of like dogmatic kind of silliness that we've been practicing that way for decades upon decades, right? Versus, could we not have just done a lot of this through the phone a long time ago? Probably. So I think like telehealth really has a lot of potential to bring that care out to some of these underserved, rural, remote, northern communities, places that just don't have access to physicians. So it really will equalize that access to care out quite a bit more, distributed across the country. I mean, in Ontario, it is interesting because it kind of like chopped the legs off of those virtual care billing codes. So I think the intent of that was mostly to prevent like telehealth companies from taking over, because you can still bill and it can be a lucrative venture, like for a doctor who is seeing his own or her own patients virtually. So like I was just saying, if they need a prescription refill, they don't have to actually come in and book a day off work to do so.
So if you still have your own panel or roster, you can see those patients virtually as well. It's more like new coming ones and solely seeing them virtually.
Exactly. So like having a company start up a telehealth operation and then have a doctor meet a new patient digitally across the province, like that basically doesn't work. Nobody's going to do that because it's just like very financially disincentivized. You could do it. You're like pretty much volunteering your time at that point. So not many people, I think, are going to do it. But if you want to keep in touch with your existing patients in Ontario, that's definitely feasible. Here in Alberta, it's a little bit more loose. It's a lot more open, and you can see patients start new patient engagements from distance. So the rules here are definitely more conducive to that virtualization of care.
Yeah. Or you then start ending up in the private payer side or self-pay side, where if you want to provide that value, then you'd ask the end consumer to pay personally, which is, I think, especially in a public payer system, something that we're not used to. And it's met with a lot of I think challenges, right?
Well, the rules on that are different too, right? Like a doctor can't charge privately for something that they're also charging publicly for. I think you have to like fully opt out of the billing system if you want to do that. So like, for example, if you want to have like a private knee surgery or something like that, which is publicly available in Canada, surgeons will fly to a different province, work at a clinic for a couple weeks, and then fly back to their home province, and then they're billing publicly on the public system for that one. So I don't know how that would actually work if you were like a family doctor seeing patients virtually. Maybe if you were on like a salaried ARP contract from like a benefits company, and part of the benefits package for employees is you have access to a telehealth provider. Maybe that's how you would get paid privately for stuff that you're also billing publicly. I'm not 100% sure. I've never done anything in that space, but you definitely, I think you can't be doing both at the same time.
Very interesting. Do you feel like it's going to move in that direction, like more into like self-pay or like private insurance?
No idea. I've heard that the Alberta government is trying to push things that way. Like, there's never been anything published, I don't think, by the Alberta government that makes that claim, but there's been a lot of actions by the Alberta government that people are interpreting as that's the direction they're trying to push things, is towards a two-tier system. So it very well could happen. Wouldn't be surprised.
I mean, I think this is where like technology really is a really interesting play as well. Like, technology in general is deflationary, right? Like trying to like improve an existing process and hopefully thereby increase efficiency. And so that could be a really interesting way, like if you make a concerted effort in terms of adoption to keep the public payer system as like more effective and keep it around as long as possible. Because I mean, there's a lot to be said for public payer healthcare systems that can provide care. I think it's really important.
Well, the virtual side, then it gets interesting because the doctors, there needs to be the financial incentive. So that's why there's been the big push here in Alberta lately for getting onto the team-based care model with complexity factored into the billing codes. Because otherwise the doctors argue that all the easy patients go to virtual care. I need a refill, I have a runny nose, you name it, right? Like the simple things that are going to take 5 minutes versus half an hour to figure out. And if the billing code remains the same, regardless of what the underlying problem was, then the doctors who are doing the more complex patients, like the older person with multiple comorbidities, they're going to take a lot longer to sort things out. So then they're feeling disenfranchised and left behind because they're like, well, why wouldn't everybody just go towards the easier side of things? The same argument's been made about walk-in clinics for decades, right? People are like, well, the easy patients just go to the walk-in, and then I'm stuck here dealing with Grandma Smith's heart failure and COPD and kidneys falling apart and everything all at once. So then it's like, okay, well, you got to make sure the incentives align.
Very interesting. I mean, this is where the complex cases are. So like the real tough conversations, longer time that you spend with the patient probably as well. So yeah, it makes complete sense. A complexity factor, very interesting.
We'll see. So there's a lot of potential there. I think there's like a lot of different ways the technology can help, and the virtual care platforms can really bring that equitable access to care, but the government needs to respond by making the financial incentives proportional depending on the situation so there aren't some people left behind. What's it like in Germany? How does their system work?
It's a two-tiered system.
Yeah.
So you've got the public, but then if you you can switch to a private healthcare insurer if you have an income above a certain amount. The very interesting thing is that if you switch to a private payer system when you're young, to the private payer insurance, you get great access, or like faster access to care, utilizing the public hospitals and resources. So you can essentially access them faster, and it comes at a cheaper cost than the public payer system.
How does that work?
Because as soon as you choose that you want to go private, you cannot go back, and then they get you when you get older. So as you get older and your bills start increasing, you start paying significant amounts, and like a multitude more, like usually like a factor of one in terms of magnitude compared to the more linear increase that you see on the public side.
I can see that. I remember hearing a statistic, I don't remember the exact numbers, but it was something like you use 90% of your entire life's healthcare spend budget in the last, I can't remember if it was 10% or 5 years of your life or something. Like it was like massively disproportionate towards when you're.
It makes complete sense. Yeah, I mean, I feel like when you look at like sort of the rapid decline of health overall, I think the goal is to always like try and stay in that high quality of life, health region as long as possible, and at some point it just starts dropping off. Right?
So what was the critique then of the hybrid private-public system in Germany? Not everyone can like it, or do they? Is it widely acclaimed as being incredible?
I think that initially it was like seen as a great solution to being able to provide great care for everyone, but if you wanted to access better care, you could. By now, because it's not that they're just like fully private clinics. In the end, when you have complex surgeries, you're still using the public system. You're running into very similar issues that you see here. It's overstretched. You have a physician shortage, you have a nursing shortage, general provider shortage, and people are working overtime and not really compensated for it. Very similar issue to here.
Sounds familiar.
Yeah, interesting pieces to that actually with the interprovincial license. And like there's a lot of conversations around like people moving around or like potentially moving around. What are your thoughts on that?
I think it's a good idea. I think it'll help more than it'll harm. A lot of people are worried that, as soon as it's I don't know, personally I doubt that a few forms and $1,000 of registration fee are locking in a doctor to a community that he or she otherwise think is not a great place to live, and they're just itching to get out of there. So I don't know, that argument to me sounds a little bit ridiculous. I mean, when you look at it at a population level, I'm sure that will happen once or twice, but I can't picture that being a common thing to occur. So, I mean, somewhere somebody is going to be like, "Look, I was right."
Yeah, for sure.
They changed the licensing, and then the doctor left because it was just easy. But I think on the whole, it'll just make it more portable. Again, easier for doctors to travel up north, go
Try
somewhere
things
else.
out. Yeah, exactly.
Try different, go to the East Coast for a working vacation, go check things out for a month or two and work while you're there. So I think it'll be a net positive overall.
Yeah, it's a very interesting mindset, the sort of that scarcity mindset around physician resources and healthcare provider resources, which is completely understandable given that we are working are a physician shortage, generally speaking. But sort of the ability to, I think, have that free flow of resources, like you said, can also be a net positive where you give people the opportunity to be there for a short period of time. And I think that's a lot of the feedback and a lot of the stigma that we've been working against with Cherry Health as well, right? Connecting healthcare is not always viewed as a positive because you're making it easier or like you're providing an insight into something that you may not want people to have a look insight in. And in the end, people want to work at great clinics where they have, a good working environment and potentially an interesting patient demographic to work with. And transparency in that regard can be challenging sometimes, but I think it's a great incentive also to then, as a clinic and an employer, to raise the bar and see what's out there.
Yep, exactly. So we heard the same feedback from a lot of people using our network of like, well, we don't want our doctors to see this platform. Like, okay, it'll help my clinic's jobs get more visibility with our locums and our temps, but then they'll see other jobs, and we're not very confident that our clinic is going to retain them. And so it's just, again, looking at it from the individual person's perspective, you follow the incentives, and they're worried. That scarcity mindset, just like you mentioned, right? It like really changes behavior. Okay, something might be in the best interest of the system as a whole, but if there's like a little bit of potential blowback on the individual, they're not going to do it.
Yeah, very interesting. And I think what that actually shifts to, and I think that is actually a net positive, is thinking about the rate limiting step within healthcare, the key limiting factor, which is the provider. And so trying to ease their life will make them appreciate the place that they work at more. And so the risk of them leaving goes down. And so I think that is like a key indicator, right? Like if you can create a great working environment, make their life easier using administrative solutions, support staff such as MOAs to kind of help them practice as best as they can and really focus on their patients. That is a great indicator for, I think, a good working environment.
Yep, exactly. Make the doctors happy, or I guess this applies to any employee. Make them happy and they'll stick around. I mean, I've seen lots of places that do it well and lots of places that do it poorly. Like one clinic I would locum at, they had a different front-end office team pretty much every time I'd get there. And so you never really got that flow, that rapport with the staff members. I remember there was always one like really wonderful MOA who stuck it out somehow for a bizarrely long time compared to everybody else. But yeah, it just like, it rips a clinic apart. Like, I don't know what it was that they were doing, but without that stability between the team members, it's very difficult to like have a well-run organization.
Yeah, taking care of your staff and employees is the key. Like in the end, business can only run with people. Like you can only do so much as a single person.
Yeah. Our generation and the Gen Zs, I think they're a little bit more fickle when it comes to careers and jobs, though. Like versus our grandparents, they'd work at the same company for 40 years and retire on their pension. Versus now, I think the average is like definitely in the low single digits for how long a job lasts.
Yeah. Loyalty is like a challenging thing. I think like what in the end matters is like mission and personal fulfillment. And if you can make those two things aligned, then people stay.
Yeah.
What are your thoughts for 2024?
What about it?
Healthcare trends. What excites you currently in the scene?
I mean, a lot of stuff on the digital side I find very enticing. I think there's a lot of like really cool new tech companies coming out now that like the AI is just so pervasive everywhere. There's like a lot of innovation coming out there. Every time we go to a conference, there's more and more of these different tech companies with like really cool, promising looking products. Even like seeing some of the older tech companies, or not necessarily old, but like the ones that we saw last year, just how things have developed over the last 12 months is incredible. So I think there's like a lot of really, really innovative stuff coming out, and I think like now that the healthcare system is sort of getting to that breaking point and everything's falling apart publicly, and it's hard to like sweep it under the rug anymore. People are like, okay, we gotta change. You know, that like slow moving, conservative, skeptical mindset is starting to shift. So now you're starting to see those people that would have typically been the late adopters starting to move up the spectrum a bit. So I think there will be a lot of good coming out of it. I don't know in terms of like the primary care system. There's just been a lot of doom and gloom about the whole system's crumbling and falling apart, and it's hard to say like really where that rock bottom is.
Yeah.
Are we there now, or can it get an order of magnitude worse? It's hard to say, but I mean, there's a lot of unrest and people are starting to like be more open-minded, so I think that'll really influence how the next couple of years go.
Yeah. Actually, speaking about Alberta specifically, you know, I think the AHS just broke into 4 different sectors.
Yep.
It's acute, continuous care, mental health, and what was the other one? Primary care.
Yep.
So yeah, it'd be really interesting to see how that breakup actually hopefully has a positive effect. I think there's like a lot of people also thinking it's a crazy move. We'll see. I mean, change also has a lot of possibility.
I respect that they're trying things, right? They're like, okay, we have a problem, we got to do something. You can't just continue to do the same things again and again and think things will get better. So
True.
Yeah, I don't know. Everyone's always skeptical anytime anything happens, but I don't know. I like to try and be optimistic and hope it'll help. I mean, their thinking was that it'll remove some layers of middle management and they'll be able to run a leaner operation by breaking the organization down into the 4. So Alberta Health Services split up. Maybe it will be leaner now.
I mean, small organizations usually means you have more capability to like look into the various processes and what's going on. Like it's very easy to get bloated when you're not seeing the forest for the trees. So that might actually, you know, work in their favor.
Then again, I don't know, that was part of like what they touted as the benefits previously, was Alberta Health Services was the largest health system across the entire country. And so they're like, well, we can be quicker, you know, there's less red tape, we can just make decisions more swiftly because there's one central decision signing authority. And they certainly have done a lot of like innovative things over the years. Like Netcare was pretty ahead of its time, so that was like the provincial system where all your labs, your blood tests, your images, your consultant reports for a patient would show up. Sort of that one patient, one record philosophy. And everywhere else didn't really have that. That was like pretty revolutionary for Alberta to have this platform. You know, you go somewhere else and you get discharged, and then you get readmitted to the hospital later that day at a different location. You know, the ambulance drove somewhere else, and they're like, what just happened? We have no record of any of this. And so that was pretty cool. Connect Care, so now this provincial-wide electronic health record system for the hospitals, which plugs in with all the EMRs in the clinic. One person I've talked to so far is liking it. Growing pains. So they're still very much in that like initial adoption period, and a lot of people are frustrated and burdened by a lot of the inefficiencies and things there, but perhaps it will be, you know, again ahead of its time and revolutionary by the time it's all settled in. Right now the vibe on the street is not particularly positive other than the one doctor. But I don't know, we'll see. I don't know, again, it's a power move, right? You know, that's one of the things that's nice about having that central health system authority, is that they can do things like that. So
very true. And I mean, like it goes along the way of like interoperability and connecting healthcare. Like in the end, like that, I think that is the play. And then the question is like more on the execution and operational side of like, is it set up in a way where it truly accelerates healthcare? And like you said, Netcare clearly did, you know, a very positive thing there. So
we'll see. Yeah.
Verdict is still out.
Maybe this challenge weighed into why they decided to split back up and separating the acute from the primary care. So we'll see.
Some thoughts on your end? What do you think?
I've never used it. I'm like, I've never actually logged on or seen it, so it's hard for me to comment there.
Fair enough. Well,
Sounds like a great idea.
Yeah, we'll have to talk to some people like maybe later next year and see how the integration is going.
Yeah.
Nice. All right. I think I think this is an interesting sort of wrap. Like from a Cherry perspective, I think interesting moves this year, like around terms of like really solidifying sort of our ability to connect people and like hopefully still help from a connectivity and job opportunity perspective. Looking to support nurses as well. So we'll see where that takes us. But
What are you the most excited about for 2024 coming up at Cherry?
I think like the initial vision was to connect healthcare. We started off with jobs and job opportunities, and really try to sort of address the physician burnout and resource and shortage problem. And then the vision was always to go further, to not just stick it out in that area, but actually provide value in other areas as well, to in the end empower physicians and healthcare providers. And we have some interesting areas that we want to focus on in the new year that go beyond job and job opportunities and really help sort of more around the administrative side and the actual delivery of care. And so I think there's a lot of exciting things that we can talk more about in the coming quarter, and that I think our users will actually start experiencing as well.
I think it'll be nice having all the allied health professionals on there. I think that really ties things together quite nicely, like in terms of all the outpatient clinics that are multidisciplinary, in terms of all the hospital teams that are running multiple facets. Like we've talked to a lot of different professions already, and the same problem exists everywhere in terms of their jobs, in terms of their locums. There just is like not often a very central platform or system for coordinating. Again, Facebook winds up being the logistics backbone for a lot of what they need to collaborate on. So it'd be really nice having them on there.
Yeah, it'd be really interesting to see that, and then also how they could potentially be used, not just from a core connecting perspective, but also from a referral standpoint, especially with allied health, which is very much underserved at the moment. And I think patients are very much left alone in finding the right provider, and by giving essentially sort of primary care the ability to actually look who's actually around, who's got time, beyond specialists, but actually within the allied healthcare sector is really something that we want to work on, and hopefully that also being an efficiency gain within the entire system.
Yeah, exactly. I mean, again, the team-based care model, right? There's just not enough doctors to go around. Let's distribute the work, right? If everyone's working at the top of their scope as efficiently as possible, that will definitely help with the access to care. It's just going to be a matter of creating those collaborations and those lines of communication. I think starting off with referrals, how do we actually find each other, who's capable of doing what, and just like getting that information more freely out there. I think that'll make a big difference.
Yeah, what are the wait times, right? Like sometimes, I think like right now, we very much rely on our personal network and the people that we've referred to in the past because our patient had a great experience, which makes complete sense, but doesn't necessarily look at the availability and wait lists and of how quickly a patient could potentially receive care. And so I think that's a very interesting opportunity that we'll be looking at actually pretty soon.
Exactly. Collecting the hive mind to start putting some of this data together, the wait times, the experience, was it positive, was it negative, was it subspecialized enough, right? Because doing it independently by trial and error for all these different practitioners in your area, you can imagine like the cycle of sending out a patient versus getting information back, right? Like how was that psychologist? Did they, versus look at any other digital marketplace right now, there's always a system for accountability on there, the insights, the data, right? Uber's got ratings, Amazon's got ratings, right? And then you look at the healthcare space, again, it's very much closed off. You don't have these insights as to anything. And so by making that more visible, more transparent, it'll just be much, much easier for practitioners to navigate. Who should I be sending this patient to? Not just for referrals, but for things that the patient can seek out themselves, helping to direct them and put things in the hands of the patients.
Yeah, 100%. In the end, like efficiency gain, but also hopefully like empowering the physician to see what's out there, and raising the bar of care in general.
Yep.
Yeah, I think lots of exciting things. I think we can close out, be really proud of where we've come to. We're super thankful for all the users that have started adopting Cherry Health, using it on a regular basis. And we can't wait to launch into the new year.
Yeah. All right. Thank you for having me on the holiday special.
It was a pleasure.